Hey guys, my name's Casey Miller. I'm a physical therapist and registered dietitian at FYZICAL in Rockville, Maryland. And today I wanted to talk to you about a passive modality, whether you should heat or ice an injury. So these are general guidelines, patient preference as well, and what makes your body feel good. Typically, new injuries, acute injuries, you would want to ice. So say you were running, walking, or you fell, those injuries you're going to want to ice. If you have an injury that's kind of been with you for a while, more of a chronic issue, some pain, some muscle pain, typically you're going to want to heat those areas. So say your neck is stiff because you're working at a desk, or maybe you're painting overhead a lot in a day and those muscles are tight. You're going to want to heat those muscles. Keep in mind that it is patient preference. For me, I tend to ice and my body responds well to that. So say if my neck is sore from a long day of work or my back, I'll use ice. These, again, keep in mind that these are passive modalities. You still want to stretch and exercise, reach out to your local physical therapists, to kind of look to see what you have going on and different things that you can do to also help heal your body. There's a lot of other methods that you can do to help heal yourself. But sometimes, it's you hurt yourself, you can't get into, see your doctor, see your physical therapist. So if it's more of an acute injury, it just kind of happened, you want to use ice. If it's more of a chronic issue, you've had this particular pain for a while, you'd want to use heat. Again, listening to your body is important. So what you respond better to. Some of my patients don't respond well to ice, so we may use heat, and some don't respond well to heat, we may use ice. Before exercise, if you want to use some heat, you can. After exercise, typically you use ice, you do an ice bath, or you can even, use some sort of ice pack on, say, your knees bothering you. It's not just helping yourself get better by using these passive modalities. You want to use a method called MICE, so you want to move the joint, move the muscle, within reason. If it's a pretty significant injury, this is why it's good to talk to your healthcare professional. So you want to move the joint, you want to ice it, you want to use compression and elevation. A lot of, if I see athletes come in, they have a sprained ankle, what I'll do is I'll ice and move the joint as well. So we'll do different ankle movements, dorsiflexion, plantar flexion, eversion, inversion. Also working the joints above and below, what might be injured, and just, getting them, maybe doing some cardio too. If there is an injury, we'll also use some blood flow restriction training to help with increased recovery time. Again, general guidelines: ice, new injuries, ice after exercise, heat typically with a chronic issue, and before exercise. All right, so if you guys have any questions, let me know. Hopefully this video has been helpful of when you should use heat or ice. But then also don't forget, listen to your body. If it doesn't respond well to heat, use ice. If it doesn't respond well to ice, use heat. I hope you enjoy the rest of your day, and thanks for listening.